a health researcher who started writing to simplify complex ideas, ended up influencing how organizations from McKinsey to the National Academy of Medicine think about AI. In this episode, you'll hear how storytelling bridges technology and health equity, why privacy fears don't have to stall progress, and what keeps public health professionals grounded right now. You're listening to the PHEC podcast, episode 451. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and trainings, ultimately helping our clients communicate their health information in plain language to their community partners as well as the broader communities they serve. The support that we provide often falls in categories of strategic planning and sometimes capacity building, just depending upon the needs of the organization. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes. My guest on this episode brings a rare combination of health research, communication strategy, and AI evaluation expertise to a field that desperately needs all three. She helps organizations cut through the noise and connect with the communities that they serve. We dive into how her work in HIV policy shaped her communication philosophy, why treating community members as experts changes everything, and how public health can move from AI hesitancy to thoughtful exploration. Let me formally introduce her, and then I'll connect our conversation. Dr. Kumba Sennaar is a health researcher, AI expert, and former director of the National Medical Association's HIV/AIDS Prevention Initiative, a collaborative partnership with the Centers for Disease Control and Prevention. Dr. Sennaar is the founder and CEO of William Kelly Consulting, LLC, with the mission to provide superior research services for innovative, mission-driven health organizations and tech companies. Organizations including the National Academy of Medicine, Deloitte, McKinsey Global Institute, and the World Economic Forum have cited Dr. Sennaar's research. Her articles on AI for business audiences have been cited by journals including the Boston University Law Review, Fordham Urban Law Journal, and the Harvard Data Science Review. She is a subject matter expert, member of the Brookings Institution Health Equity and AI Working Group, whose report, Health and AI Advancing Responsible and Ethical AI for All Communities, was released in March of 2025. Dr. Sennaar's TED Talk, Reducing Algorithmic Bias in AI, released in 2024. She has been an invited speaker by institutions including the Woodrow Wilson International Center for Scholars, United Nations Population Fund, UMass Chan Medical School 2024, and the American Public Health Association 2025. Let's connect my conversation with Dr. Sennaar right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. Well, good morning at the time of this recording. Dr. Kumba Sennaar is joining me for this conversation, and I'm so excited about it. This has been kind of a long time in the making. We've been talking about this and working on it, trying to get together for several months. Dr. Sennaar, welcome to the podcast. How are you?
I'm good, Dr. Huntley. Thank you so much for having me.
Yeah, I am. Before we hit record, we were chatting about our weather, and here in South Carolina, just this past weekend, we had a snowstorm, which is very unusual, which also the storm was large enough to span over your area, and you're in the DC, Maryland, Virginia area.
Yeah, we're still melting out, so
Yeah.
it was a big one for us. So yeah, it's more normal this way than South
Right.
Carolina, but yeah, but still.
Well, I'm really happy to have you here. There's so much for us to dive into. So let's start with you just telling everyone a little bit about yourself.
Sure. Thank you. So I'm a health researcher. I'm a communication strategist, and I have expertise in AI evaluation. And the way that I like to frame it is that I'm really a storyteller, and I've been writing for a long time. And writing is what actually led me into how I got into AI. And my purpose there really has been to simplify understanding of the technology and its impact and implications and translating that for broad audiences.
Love that. Love that so much. And I know this is going to be good because I already know there's so many things based off of what you just said I want to dive into. You touched on the communications piece. Of course, that's like you speak in my love language, but the storytelling, that's also something that we need more of in public health.
Absolutely. Yeah. Especially right now.
Yes.
It's always been, but it's just the moment is showing us how imperative it is.
We're realizing that we don't really know how to do that very well. Like we think we've been telling the stories, but really we have such room for improvement. So I'm sure we'll dive into that also. But one of my favorite questions for my guests on this podcast is this one I'm going to ask you, and it's really about kind of rolling back to get a little bit of a picture of the journey of how you got where you are. So before we dive into all the things I want to dive into, when did you first hear about or become interested in public health as a career?
Sure. A long time ago, health and communicating information about health and looking at approaches and ways to support health promotion more broadly started actually in childhood. I always knew I was going to be in the health space a long time ago. The path took its dips and turns, but I always had a passion for understanding how health works, how to improve it from a research perspective and policy perspective. So it's been since childhood that I've been interested in this world.
That's awesome. And I think a lot of folks that I interview, it's kind of the retrospective view. Like for me, I knew I was interested, but I didn't know that that was public health. I didn't understand what that was. So it kind of went around the way to discover, oh, that I could do this thing, and this is exactly what I was always interested in.
And I think if you have that spark, so to speak, and something's pulling you, drawing you, exciting you, I say let the path kind of lead you. I learned that along the way. Sometimes you get, particularly scientists and health professionals, we are very focused on our work and very specific about what we're pursuing and where we hope to go, particularly if we're just starting out on the journey. And I always try to tell folks to have your goals, absolutely, but also be open to where the journey can take you because that's really served me really well.
Yeah, that's great. Great. That's like a little gold nugget to tuck away right there. So you mentioned some interest areas when you introduce yourself. Is there a particular issue or population or public health challenge that really draws you, catches your attention?
Yeah, I love that question because it was very interesting for me coming out of my initial preparation as a scientist and then also integrating that with social science. One of my earlier roles, infectious diseases was really the gateway for me into the public health sphere, both in the clinical context, but also in the public health context more broadly. And that formalized within the Infectious Diseases Society of America. I had an opportunity to serve as the program and policy manager for the HIV Medicine Association, which is housed within the Infectious Diseases Society of America. And they are US and global community of public health experts and clinicians all over that are deeply committed to this work. And of course, as the name states, HIV was kind of my area. I didn't plan that. Just happened to be an opportunity that really seemed to be powerful in terms of exposure to policy, research, and advocacy. And that intersection of policy and advocacy has kind of stayed with me along the journey. What was particularly some highlights through that opportunity was not only the work of supporting the physicians and clinicians and public health experts that are on the ground and dealing with people living with HIV, but also helping to train those folks and advocating for the priorities that are directly impacting the populations that they serve. And so I was really excited to receive training through the work and then be able to train those experts going to Capitol Hill, speaking to members of Congress and the Senate and how to do it, how to frame it, particularly emerging folks that were just coming out and settling into their practices and their work. And that was really exciting and invigorating work for me to know that that work was directly impacting the sustainability of the Ryan White HIV/AIDS program or PEPFAR, those really essential programs. So, and all that was happening during the first Trump administration, by the way. So it was an interesting time to enter into all of that. But I credit the world of infectious diseases and more specifically HIV, and that kind of led to an opportunity to lead an HIV prevention and education opportunity for the National Medical Association. And this was a collaborative partnership with the CDC. So I was tasked with working directly as that intermediate between the organization and the CDC to make sure that we were reaching our goals. And it was a multi-year HIV prevention partnership. And through that work, we were able to touch over 1,000 physicians of color across the country and helping them communicate HIV prevention, HIV treatment, and it was really powerful work. And it was not only just dealing with public health experts and clinicians, but also the people living with HIV, people on the ground, CBOs, community-based organizations. So that was extremely rewarding and a nice kind of journey from where I started. So yeah, that's a long answer to the question of where did it begin, and infectious diseases is where it started for me.
Thank you for sharing those details. I'm always, in giving advice, I think it's important to follow your curiosity, like, very
Absolutely.
pretty much
It's a
what you
mistake
said.
not to. It's a
Right.
mistake not to. Yeah.
That will, if you're naturally drawn or interested and curious, I think you will ask the right questions because you wanna know for yourself, and you just uncover what's under this rock or what's behind this corner, and it leads you in the direction that opens up other possibilities and opportunities.
Absolutely. Yes.
So, thinking about, especially when you're talking about, being kinda drawn into policy and advocacy, and I think it's interesting for myself because if you had asked me a decade ago, "You consider yourself an advocate?" I'm like, "Oh, no, but I do support
Oh,
those folks." I need those people that are gonna do that, but that's not me, but I very much that to my core. So, as you have progressed along doing this work, especially, the opportunities you just described, how did you get to what you're doing now? Maybe you can tell us a little bit more about what you're currently doing and kinda how did that, segue into what you're currently doing?
yeah. So just to go a little bit back, as I mentioned earlier about kind of how I got into the AI space and where I am now was really again through writing and communicating. And while I was doing all these things, I always had a passion for writing and research. And so I freelanced for many years, actually. And that freelancing kind of led into an opportunity for a new AI research firm that was just starting up at the time. And this is before the LLMs and the chat GPs. This is like almost a decade now, which is crazy. And it's been amazing to watch what's happened. But it was an opportunity to start writing about AI. And, back then we were talking about cutting through the hype. And I really think we need to keep bringing that back because I think a lot of people are starting to sort of think about that in terms of, okay, what can it really do? How can we help shape it and improve it and that kind of a thing? But I ended up doing several articles during my time with that firm. And as a result, it started to catch a little bit of a fire in terms of folks noticing the work and finding value in it, in terms of it making complex ideas easier to digest, resonate more strongly in terms of folks' goals. And this was really geared towards busy business folks, actually, to be completely honest, they're not in this area. They don't understand all of this. They need to know bottom line. What does it do? How does it work? And that's basically it. Is it doing what it's supposed to do? Can it help me? And tell me quickly and concisely and back it up with real research. And so that was my job. And over time, we started to notice that folks were citing the research, and National Academy of Medicine was citing the research, and McKinsey and World Economic Forum. And so I started to see, wow, how I'm approaching this work is resonating, and it's offering value very broadly and very widely. And so that kind of inspired continuing to kind of zone in on that intersection of health communication and applications of technology such as AI, and that led to my own consulting firm, William Kelly Consulting, and that's what we do. We help organizations with that, with health communication strategy, research support more broadly, and just helping them tailor and really bring the messaging in a way that connects and that is clear. And that's something we're really still grappling with, I think.
Yeah. Yeah. So much there. So I have so many questions. My brain is like, da, 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 da. So I want to know a little bit more about, so the organizations that bring you in for, the technology piece, the communication, the AI, I feel like public health as an industry is much more hesitant and a little bit, I mean, we tend to fall behind on technology in general. We're not necessarily leading industry in technology. But when it comes to I feel that there are these polarized groups. There are those that are curious and really want to explore how it can help improve and advance, and they're diving in and giving it a try. It's a very small group from my perspective. But there's a larger group that's much more hesitant, and I understand the hesitations, the concerns. We want to protect data, we want to privacy, all those things. But I think that it's preventing any exploration. So I'm wondering just kind of what are your thoughts about those kind of, do you see that also? And like, how do you kind of bridge that gap?
That's a great question. I think I saw it quite early, particularly in my doctoral work when I was taking a deeper dive after the research that I initiated in the AI space. I think as an industry itself, it's very siloed, unfortunately. And that's the biggest opportunity, I think, one of the biggest opportunities that we have. So it's not public health's fault, it's not healthcare's fault, it's just unfortunately a natural consequence of becoming experts in particular areas. Tech folks have not always been exposed to that kind of collaboration. It's not their fault, it's their training. And the same thing with public health experts. It's not the training to get in the same room with someone that's doing software development or coder or someone, and we're sitting together and we're talking at the same time about concerns and what's working and adjusting. And it's just not how things have traditionally been done. But where I think the opportunity is to start to normalize that kind of collaboration from the get-go. For those that are more hesitant, makes total sense to me. Unfortunately, it's very much here and very much embedded pretty much across all industries already. So I think the opportunity now can move from hesitancy to exploration. So let's evaluate and assess what are the barriers, what are the concerns that are preventing us from exploring how we can take advantage of this opportunity or not. You may find when you do a comprehensive evaluation or assessment, it's just not for us right now. And that could be very structural. You could be in a rural community and your infrastructure is limited or your funding is limited. It's not for us right now. You could be a larger urban institution that does have the funding and you're grappling with, all the ways in which this is creating new burdens of more work and more training needing, you know what I mean? So it really depends on specific environments and infrastructure and staffing capability to make it all make sense. But I do think it's the time to evaluate and not to allow hesitancy to be the reason why progress or new opportunities may be delayed.
Right. Okay, so I have one more extra question on this based on kind of our conversation. I hear a lot of concern for privacy.
Oh,
So,
yeah.
when that data goes
Me
in
too.
for so especially
Yeah.
for like your background in evaluation. So and I'm thinking I serve as a consultant, the clients that I serve are large nonprofits, and they're usually serving communities of color. So they're going to be very careful and cautious about protecting that data, right? So what I hear often is how the concern about when that data goes into AI, then it's owned by AI. Yeah, and so are just in as at a high level, are there improvements with privacy and protections for those concerns as AI is advancing so quickly and rapidly in the last, couple of years? Are we at a place where there are options and better protections in those kind of situations where there's real concern about the privacy and protection of data?
Yeah, this is a serious point, perhaps one of the most serious points of this whole thing. And for me, has been a concern for me the whole time, and will continue to be a top priority for me as well, even being deeply in the space. The answer is yes. The question really is, who are we collaborating with? What are their policies? What is transparent about their privacy policies? How long are they holding on to data? Are they selling data? We need to understand the policies of the collaborators that we're working with. And I do say emphasis on collaborators. It shouldn't just be a provider. It should be someone that you can talk to that's transparent and open about this is how it works and who may be open to adjusting or modifying the approach based on whatever our particular goals are in a particular collaboration. So they may do things one way typically, but for this particular project, we're only going to retain data for X amount of time and then we're going to get rid of it completely. Those kinds of agreements should be as transparent as possible. And we're getting to a place where we can take learnings from other standard approaches to privacy like HIPAA and other different things and take learnings from those and adopt those to this, even though it's a little different. But it doesn't mean that there's a lot of work in the AI evaluation space that's rapidly trying to catch up to what's going on in terms of improving privacy infrastructure. But that has to be a documented and clear conversation between the client and provider.
Oh, thank you. That's such a great response. Actually, your mention of HIPAA was really great because I've been in working, in healthcare, public health for a whole lot of years. So I clearly remember a time before we had HIPAA,
There you go. There you go.
and then, so
And it's like, well,
thinking
what do we
about,
do? And how
right.
exactly,
And then
exactly.
thinking about, okay, now we created that and refined and worked on that. So now we've got that in a point where most people are going to understand HIPAA when we talk about it. And so now we're probably at that stage of we need to create something like that for regarding AI because we need to keep moving. And that's it puts it in my mind. It helps me settle a little bit. Okay, well, it's possible. We just
Oh,
have to create
it's
what this
necessary and
is.
it's happening. We have a lot more work to do, but it's already happening. Like people are starting to get it. Like, okay, and then we don't have to pull it out of the sky. We can pull it from structures that have worked and reimagine it.
That's wonderful. Thank you for entertaining my extra questions because we went a little bit, but
Sure, yeah, they're great questions.
I
Yeah.
feel like based on conversations I have with people across the industry, these are the things that are in a lot of folks'
Top of
minds.
mind. Yeah,
hmm
yeah.
Well, let's shift a little bit into what I like to talk about connecting the dots because I think again, kind of touching on storytelling and so forth. I think it's nice if we can not just leave things with people when we talk about it, but let's really start when we talk about public health and but just really start to connect the dots either through a story or example. And I feel like I'm on a soapbox, but I do personally. I say this all the time. If we can relate public health, explain it in plain language to non-scientific people, to our friends, family that love us and support us, but maybe they're not in our industry, if they can really understand what we do, our neighbors, people around us, and through the lens of which, the way that we work, we explain it to them, then they're armed with that knowledge, like that truth. They start explaining that to other people. They start to really get it in that context. And if we get more community buy-in, it's going to
Like a chain
arm
reaction in a positive way. Yeah.
exactly the policymakers, the legislators. We get, we're not as easily erased and removed, our programs and important support systems. So that's kind of the foundation of my next question for you. How do you explain the importance of the work that you do and its connection to public health in plain language conversations to, your family, friends, and people in the community?
Yeah, that's so important. And, as I shared earlier, really a passion for me working with that because it's not It's not always easy. But one of the ways that I always approach it is I always center whatever I'm saying on my audiences. So I never start from the perspective of this is the message I've got to get out because this is super important information and the work that we all do is extremely vital. But we can't allow our passion and our impetus for wanting to get our message out overshadow the fact that you don't know the stories behind the audiences you're speaking to. Let's get inside their world first. And that's how I deal with research as well. One of my, I guess, missions or one of my principles personally with how I try to approach health research has always been treating the participants in the research as experts because it's so easy to say there's a team of experts conducting X or team of public health experts are coming in to evaluate X. But very rarely am I hearing language sort of normalized around the idea of those folks that are over there. Those are experts too. We're all experts. People with lived experience are the experts of their experience. So if you approach communicating whatever you're bringing forward in a way where I'm respecting you as a colleague, as a peer, I think research subject is a bit of an outdated term. And I think health consumer is very broad, doesn't really allow you to have a tangible feeling for what does that mean. And the truth is anyone that cares about health is a health consumer. So that means all of us. So really treating it more of like a community idea of, okay, I'm bringing this to the table, but I know you're an expert in the quality of the air in your community, access to fresh food, access to clean water, whether you're in this country or in a different country or wherever you are. So that's how I try to approach explaining my work and communicating my work by learning from the experts that are living through what we claim we're trying to help improve.
Yes. Oh my goodness. I love that so much. I agree with you. I hear that quite often and it's a humbling
It
positioning
really is.
and it's an important reminder because then we're ready to really learn as much as we want to be able to teach them, but we're really in a
Correct.
position to learn and we will really embrace that humble position. They will sense that the community
Always.
always, yeah. They know right away when you're really genuine and then they will open up and share. Love that. I have another question for you before we wrap up. And I think about the people who listen to this podcast, and we are in very difficult times in public health. Is there any bit of advice, words of encouragement that you could share with anyone listening who's doing this work in public health during these very challenging times?
Absolutely. Yeah, I would like to just posit that it's an opportunity for anyone that's really struggling right now or any time to really remember their why. Remember the spark, remember why they came to the work. Without being able to go back and access that kind of fountain, it makes it very bleak and makes you question why are you even doing this? So I think going back to that because every day that this work is getting done, lives are continuing to be saved. So it may mean you have to pivot how you do your work depending on what's going on in your situation. But if you are still committed and passionate to health equity and improving health outcomes and better quality of life for all, then you really have to go back to that why when it gets to that point. And I always try to keep things in context the same way we had that little HIPAA conversation earlier that there's always been moments in history that are just like, what is going on? And we always manage as a country to find our feet. So that's what I try to also, from a kind of longer vision, I try to always encourage folks to just go back to their personal purpose, their personal why.
That's wonderful. I love that. And it's that keeps me going, keeps me showing up. So thank you for sharing that. Thank you for that wonderful advice. And as we wrap up, because this has been such a great conversation, we're going to have to bring you back at a point in the future because AI is always changing and there's always these challenges. And I would love to, have you back again in the future and share some more insights. I'm going to share how to get to the show notes where we'll have a lot of connection. But for anyone listening right now, what is the best way to connect with you?
Sure. So that is our website, which is W as in William, K as in kite hyphen content. So WK public-health-content.com. And we're actually working on building a health communication solution right now. We're recognizing that this is a major gap that has real serious consequences. And so we're in the process of collecting real stories from health professionals. And if this resonates with anyone listening out there, reach out to us. And we'd love to hear your story to help us build and shape what we're working on. So, yeah.
Oh, that's great. Make sure that we have those links in the show notes, and I'll tell everyone how to get to that in just a moment. But right now, I just want to thank you for your time and attention, and just you generously shared so much in this conversation for this episode. So I really appreciate you.
It's been an absolute pleasure. Thank you so much for having me.
I really hope you enjoyed that conversation as much as we did. Dr. Sennaar's work is a reminder that the most powerful public health tool isn't data or technology alone. It's the ability to communicate in a way that respects and connects with people. Whether she's training clinicians to advocate on Capitol Hill, helping organizations navigate AI responsibly, or building health communication solutions from the ground up, the thread is the same. Meet people where they are and learn from them. In a challenging moment for public health, her advice is clear. Go back to your why. That spark is what sustains the work and the people doing it. I encourage you to connect with Dr. Sennaar and learn more about the great work that she's doing. You can find links to connect with her on the show notes page. The show notes page for this episode, which is episode 451, can be found at phecpodcast.com. Once you're there, just navigate to episode 451 to find the show notes. One more thing before we go. Remember that our podcast has an app and private community independent of social media platforms where you can engage with public health professionals around the world. In addition to being a part of this community, this amazing community, your membership supports the production of this podcast and episodes like this one. You can download the PHEC Podcast Community app in your mobile app store, and it is available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.